Rim scan. Okay.
My name is Hesham. I consent to being video recorded for the purpose of the health assessment video assignment for the spring 2025 semester. I am being recorded voluntarily. I'm over the age of 18 and understand that after this video is reviewed by the health assessment course faculty, it will be deleted.
Hi, my name is Tahani Hesham. I'm a student nurse practitioner at SUNY downstate. I'll be conducting a head-to-toe exam. I'm going to start by washing my hands, pulling the curtains for privacy, and I'm going to first inspect your skin, okay? So I can see that the skin is warm to touch. It's well hydrated, good skin turgor. There's no lesions, masks, or rashes. Next, I'm going to inspect the mole using the ABCDE skin assessment tool. The A is symmetrical. The B borders are clear. C, the color is light brown. D, diameter is 1 millimeter in length. E, there is no elevation. Next, I'm going to examine the skull. I don't feel any deformities. The skull is symmetric. I'm going to examine the hair and the scalp, and I see that the scalp is without lesions. There's no rashes. The hair is clean. There's no lice, and there's no hair loss. Good. Next, I'm going to dim the light and use an ophthalmoscope to examine the eyes. Okay, with my right eye, I can see I'm looking at your right eye, and then with my left eye, I'm looking at your left eye, and I can see the red reflex, which indicates the retina orange glow, and I can clearly see the ophthalmic disc. There's no lesions. Next, I'm going to do the corneal light reflex, and I'm going to use pen light. I'm going to shine, this is the Hirschberg test. I'm going to shine the light in between both eyes, and I can see that the cornea is midline, and the reflection is symmetric. Next, I'm going to assess the pupil reaction to light. So I'm going to shine the light into the left eye, and I can see that the pupils are equal, round, and reactive to light, and the left eye has direct, is constricting, and then consensual. It means that the opposite eye constricts when I shine the light into the left eye. I'm also going to examine the pupil response, accommodation, and conversions. So I'm going to hold the pen in front of the face, and I can see that the eyes come together, and when I bring them close to the nose, the eyes are able to focus and constrict, and then when I bring the pen far away, the eyes dilate. Next, I'm going to check an optic nerve 2, the visual field of confrontation, to test a peripheral vision. I'm going to, if you could just face me. Okay, good. I'll cover one eye, and I'm going to cover one eye, and you can tell me what numbers am I holding?
Two.
Very good. And the other eye?
Two.
Very good. Next, I'm going to test the visual acuity test using this Snellen chart, and you're going to need your glasses for this. Okay, very good. And at the smallest line, can you just read the smallest line that you can clearly see? And I'm standing 20 feet away.
FEZTCUD.
Very good. Patient has 20/20 vision, which means that the patient can see at 20 feet what a person with normal vision can see at 20 feet. Okay, you can come back this way. Next, I'm going to test the visual. I'm going to test the visual, corneal blink reflex, which is trigeminal nerve 5. I'm going to have you look up and away. Here, I'll take your glasses. If you can just look up and away, and I'm going to lightly touch the cornea with the tissue, and you are able to blink. Good. Next, I'm going to test the, I see that the sclera and the conjunctiva is clear. There's no discoloration, there's no discharge, and no lesions. Next, I'm going to test the, I'm gonna take a look at the ears using an otoscope. So I'm gonna hold the auricle up and back and look through, and I see the tympanic membrane is pearly gray. There's no perforation, no effusion, and I can clearly see the bony ossicles and the cone of light. Next, I'm going to test the hearing conduction using a Webner, the Weber's test. I'm going to strike the tuning fork and place it over the midline of your head. Do you feel the sounds equally, or is it more in one ear than the other?
Equally.
Okay, great. I'm going to test the acoustic nerve, which is cranial nerve 8, and I'm going to whisper a number behind you. Just tell me what number do you hear. Hold, just occlude one ear.
99.
And the other ear?
99.
Very good. Next, I'm going to test the nose. I can see that the external narrows, there's no swelling, there's no bleeding. I'm going to palpate. I don't feel any deviated septum. I'm going to do a patency test. If you can keep your mouth closed, occlude one nose at a time, breathe in. No obstruction. And the other one, good. Next, I'm gonna test the olfactory nerve, cranial nerve 1. And please close your eyes, occlude one nostril. And what do you smell?
Coffee.
And the other one?
Coffee.
Very good. Next, I'm going to test the sinuses. I'm gonna palpate the frontal sinuses and then the maxillary sinuses. And do you feel any tenderness? I don't feel any masses. I'm gonna test the oral cavity. If you can open your mouth. Great. I see the lips and the gums are pink, moist, and intact, and the teeth are clean. Under the tongue, I don't see any lesions or masses or ulcers. In the hard palate, I don't see any lesions or ulcers. The pharynx and the tonsils, there's no swelling or exudate, and the oral mucosa is moist and intact. I'm going to test for cranial nerve 9 and 10. If you can open your mouth and say ah. Okay. And I'm using my pen light. I see that there's no hoarseness when you speak, and the pharynx and the hard palate is normal. Next, I'm going to test the cranial nerve 12. Can you stick out your tongue, please, and move it side to side, and push the tongue against your cheek? Okay, very good. And that is intact. Next, I'm going to test cranial nerve 7, the facial nerve. Tell me where you feel soft. Close your eyes. And do you feel soft or hard? Rough. Soft or rough? I'm sorry. Again?
Soft.
Okay, good. And then soft or rough?
Rough.
Okay, soft or rough?
Soft.
Okay, and soft or rough?
Rough.
Very good. Okay, great. Next, I'm going to test your lymph nodes. This is in front of the ear, this is preauricular, behind the ear, posterolateral, and occipital, and this is cervical, submandibular, and submental, and this is post cervical, superficial cervical, and this is the supraclavicular. Okay, very good. Next, I'm going to test the, take a look at the trachea. If you can lift your head up, please. Okay, the trachea is midline. And I can see, I'm going to, I don't see any masses. I'm gonna palpate the trachea. So I'm gonna shift the trachea to the left and then the right. I don't feel any masses or enlargement. I'm gonna test the thyroid next. So can you swallow? Okay, good. I feel the thyroid isthmus rise up when you swallow, and there is no enlargement. Next, I'm going to test the thorax. So the thorax, I can see upon inspection, the anterior posterior thorax ratio is 1 to 2, and the skin of the anterior posterior thorax is good. I can see the respiratory rate, rhythm, and depth is within normal range. There's no use of accessory muscles, and there is the respiratory effort is unlabored. Okay, if you can come and sit here so you can face the back, I'm gonna assess the posterior, or you could stand. Okay, so the posterior thorax, I see upon palpation, and the anterior upon palpation, there's no masses. And the posterior thorax, I'm gonna test for tactile firmness. Just say 99 until I say stop.
99, 99, 99.
Okay, good. I feel vibrations to my hand, which is a normal finding. And then I'm going to test for the respiratory expansion. So taking a big deep breath in. Very good. And my thumbs move apart during inspiration, which tells me you have good respiratory expansion. Next, I'm going to percuss over the intercostal spaces. Okay, and I can hear resonance, so I can there throughout the lungs and dullness over the diaphragm, which is a normal finding. Next, I am going to auscultate the thorax. Take for one full breath using the diaphragm. Okay, breathe in, breathe out, 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 breathe in, breathe out. Very good. Now I'm going to listen for abnormal sounds. I want you, every time my stethoscope touches your back, say the letter E.
E, 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 E.
Okay, very good. And the E does sound like an E sound, so that's a normal finding. So next, I'm going to percuss over the, I'm gonna test for the CVA tenderness, which is around the 12th rib. So I'm going to percuss here. Any tenderness? Okay, great. Have a seat here. Okay, so next I'm going to palpate for the abdominal, for the aortic bruits. So the carotid arteries. So I'm going to feel one pulse at a time, and they're 2+ and normal, and they are fine. Next, I'm going to auscultate using the diaphragm to listen for carotid bruits. So breathe in and hold. Good, breathe in and hold, and I don't feel any bruits. I'm going to auscultate the heart sounds now, starting at the right. Pull the right second intercostal is the aortic. Move over to the left second intercostal space is the pulmonic. The fourth intercostal is left mid-clavicular line is the tricuspid, and the fifth mid-clavicular space is the mitral valve, and I don't hear any abnormal sounds. Okay, next I'm going to have you go over to the left lateral position, if you could lay on your left side. Okay, and I'm gonna auscultate for the S3 using the bell of my stethoscope, and I'm going to over the fifth mid-clavicular space, which is the mitral valve. I don't hear any abnormalities. Okay, you can come over on your back, and I'm going to assess for your pulses. So I'm going to palpate the brachial pulses, and then the radial pulses, and then the popliteal pulses. They're 2+, normal and equally bilaterally on both sides. I'm checking the lower extremities. I don't see any poor circulation, and I don't see any edema. I'm going to now assess the abdomen. So for the abdomen, I'm going to I see that the abdomen is non-tender and it is, the movement is symmetric. I'm going to auscultate the abdomen using the diaphragm, and okay, and I see that the, I can hear that the abdomen is normal and active in all 4 quadrants. Next, I can hear, I'm going to assess the abdominal bruits. So I'm gonna start at the aortic artery, and then renal bilateral, and then iliac bilateral, and I don't hear any bruits. Next, I'm going to percuss over the abdomen. Okay, and I don't hear any, I hear tympani, and that's a normal finding. Next, I'm going to palpate for the liver span, percuss over the liver span, and this is starting at the right umbilicus, so it's going to, and then I'll percuss upwards until I hear dullness. So, okay, great, I hear dullness here, so this is the lower border of the liver, and then I'm gonna start the nipple line and percuss downwards until I hear dullness. Okay, good, I hear dullness. So the liver span is here, which is about 7 centimeters, and that is a normal finding. Next, I'm gonna do soft palpation and then firm palpation. Let me know if you feel any tenderness. No tenderness. Okay, now I'm gonna do firm palpation. Okay, any tenderness? Okay, good. And I don't feel any masses or lumps either. Next, I'm gonna assess the right lower quadrant for the rebound tenderness. So I'm gonna press down and then lift up quickly. Do you feel any pain?
Yeah.
Okay, good. I'm gonna do the sus sign, which is also the cup sign. So elevate the right leg. Good. Do you feel any right lower quadrant pain?
No.
Okay, very good. Next, I'm going to palpate for the liver, the kidneys. So if you can just shift down a little bit, if you're able to. Okay, great. And I'm going to place my left hand over the left kidney, and then my right hand over the costal space, and taking a deep breath. Hold it. Okay, and I'm pushing my fingers down together and release the air slowly. Okay, good. And that's good. And next, I'm going to assess the Murphy sign. So I'm gonna curve my fingers around the ribs over here, and taking a deep breath. Any pain here? Okay, and again. Okay, good. And there's no tenderness. Okay, good. And that concludes